Hey guys, I hope you guys are doing great. This is Dr. T, and once again, welcome to Clinical Medicine with Dr. T. So, guys, this afternoon, as you have seen, we have started a new series on mood disorders, and we did explain that. I want you guys to visualize this. We did explain that this side we've got an elevated mood. And this side we've got a depressed mood, right? And then here, that's where we spoke about the types of bipolars, because you have a bit of this side and a bit of this side. That's why I put it in the middle. So this is gonna be bipolar mood disorders or bipolar and related disorders. So what I want us to talk about in this episode is depressed or depressive disorders, and we did mention them. So please watch the introduction before you come and watch this video so that you can follow. Okay, so we're going to be talking about the first condition we're going to be talking about is a major depressive disorder. Major depressive disorder, also known as MDD. Guys, criteria are very important, ne? Criteria are very, very, very important. It's important to know the criteria. So, major depressive disorder, also known as MDD, is the first depressive disorder that we're going to be talking about. And for this to be diagnosed, you need 5 symptoms. That's the first thing. You need 5 or more symptoms. So you need a minimum of 5 symptoms. And these symptoms must have been there together for a period of 2 weeks. Durations are very important in psychiatry because most of the times you differentiate one condition from another on the basis of the duration and the timing, right? For instance, someone who gets depressive symptoms after they've given birth, the timing is after they've given birth or before they gave birth. That's peripartum. But if you have not delivered, you have not, so it can't be peripartum. So the timing becomes important. If you get a depressive episode after, but we are going to talk about these things. So the duration is very important in psychiatry. Duration of symptoms is very important because in other conditions, it is the only thing that differentiates one condition from another. Just like schizophrenia and schizophrenia, they are very, very similar. The difference there, one of the differences is the duration. Yes, there are other differences as well that we spoke about, but so the duration and the timing is very important. And out of these 5 symptoms, you need one of those symptoms to be either a depressed mood or loss of interest or pleasure in almost all activities or all activities. I hope you get that, guys. Out of these 5 symptoms that we're going to talk about, one of those symptoms must either be this or this. One of those, né? And then there must also be a change in functionality as well. There must be a significant change in functionality. You see, something like, for instance, something like a mania. Mania is an elevated mood. The people there are very happy, but their happiness is not normal because it puts them at risk. There's risky behavior involved. You might ask yourself, what's wrong with being happy? You don't want to be too happy. You don't want to be too excited. Because when they are too happy, too excited, they engage in wrong relationships. They engaged in risky behaviors. They can spend all their money in a blink of an eye. They can be involved in so that's the thing. So they are happy. That kind of happiness is self-destructive most of the times. So you don't want that. No one should distract themselves and others because of their mood. If a mood does that, it means it's an abnormal mood. Okay. So when someone says I'm sad, when someone says I've got a depressed mood, so this depressed mood can either be, the patient can either report themselves to their relative or to the health, to a doctor or a nurse, and then they will describe themselves as being empty, as being sad, as being hopeless, right? Or it can be observed by someone else, a relative, a spouse, a doctor. They will appear tearful, right? So that's what we're talking about when we're talking about a depressed mood, right? So that's the first one. So this is the first symptom, and so that's the first symptom, depressed mood. So remember, this depressed mood, according to this, can either be the patient can report themselves and describe themselves with these words or even other words, or it can be something that someone else did observe. And then another one would be so they will have a decreased interest in all activities or most of the activities, even if it's activities even activities that they used to enjoy before. So decreased interest or pleasure in almost all activities, or almost all activities. So these are the symptoms, guys, that we're talking about here. The third one is weight. Weight can either be a weight loss or a weight gain, and this weight gain must be unintentional. So it must not be someone who's exercising. It must not be someone who's on diet, or someone who's planning to gain weight through weightlifting and all of that. So it must be unintentional. Very important. And they must lose about 5% of their body weight. Obviously, it becomes tricky if the patient has not checked their weight recently. And then number 4, they get sleep disturbances as well. And the kind of sleep disturbance that they get, they can either have insomnia, or hypersomnia. Right? Insomnia or hypersomnia. And then number 5, psychomotor abnormalities. So the psychomotor can either be in agitation, but most of the times it's retardation. Psychomotor agitation is common in mania, it's common in psychotic patients, but most of the times patients that have got depressive disorders, they usually have psychomotor retardation. I'm not saying they cannot have agitation. Yes, they can, but most of the times it's retardation. Agitation. Psychomotor abnormalities. And then they can also have or report feeling worthless, feeling worthless. They can report feeling worthless. They might also have, I actually have a patient like this in the ward. They have, this guy has got inappropriate self-blame or or guilt. Inappropriate guilt. These kind of people will, like this guy in the ward, he's blaming himself. You know, whenever you try to do his MSE, every day every time you go and do his MSE, he always blames himself of something, and it changes every day. The first time I met him, he blamed himself that he stepped someone, and he feel that he should go and apologize. But the person didn't die. Then the other time I met him, he blamed himself that he has wronged a lot of people, but couldn't really say. Then the other time I met him, he said he was blaming himself that he killed his father's dog. And then when I met him on Monday, yesterday, he was saying that he needs to go to the police to rewrite or to have an affidavit that he did, to have it removed, because that affidavit, he wants to go and apologize to some people. So this guy has got this, and this thing can be delusional. You find that there's nothing like that, but it's just that there is this feeling that is inside that is so strong that you are to be blamed for this and that and that and that. Sometimes you might find that these things actually did happen. Some of them, they did happen, but he was not on the wrong. So it becomes very difficult. That's why you need collateral to really know what is really happening. But that patient has got that. Feeling worthless, inappropriate guilt, or excessive guilt, so things like that. So another thing now that they will also start to have is they will have, this is where now they become not functional, because now the state they are in, it affects the way they think. They become slow in thinking, they become very indecisive, they've got poor concentration, So they will also complain of fatigue or loss of energy. Sorry about that. And also, they might also have recurrent suicide thoughts. And this can go as far as attempting suicide. Or they can just have thoughts without a plan, or they might have thoughts with a concrete plan. So it can stretch that far. So guys, these are the symptoms of someone. This is the criteria that a patient must meet. So as we said, that out of all of these, we need a minimum of 5. And one of those symptoms, the 5, should be a depressed mood, like we explained here what we mean, or loss of interest or pleasure. So you need those, right? So now let's talk about criteria. Let's talk about criteria. This is criteria A, this is criteria B. So criteria B states that this patient must have obvious or significant reduction in functionality, as I mentioned up there. Functionality. And when you've got a reduction in functionality, it means that your cognition is already involved. So they don't think straight, they're indecisive, they're slow thinkers, and all of that. So the areas that must be affected, it must be academics, at work, or any other interpersonal relations, or any other major functional areas, right? So it can be at work, it can be at school, it can be, like I mentioned, interpersonal relations, things like that. That's B. And then criteria C. So these symptoms must not be due to they must not be due to a substance. That's why whenever a patient who's got psychiatric symptoms, they are always done wake up, take urine, take blood, all those things, because you want to see in the urine, are they having any substance that can explain these symptoms. So you want to rule out the possibility of them using substances, and also you want to rule out so these symptoms must not be due to some kind of medication as well. And that's C. And then D, these symptoms must not be due to any other psychotic disorders. Like the ones that they mentioned for this condition, they mention all the psychotic disorders, like schizophrenia and schizophrenia spectrum and related disorders. So these symptoms must not be better explained by schizoaffective. Let me put it that way. Schizoaffective. So if this patient, so this is a mood problem, right? MDD is a mood disorder. So the affect part is there. So which means now, for us to say this patient has got MDD, they must not have the schizo part, which is the psychotic part. So they must not have schizoaffective, which means it's important to make sure that they don't have psychotic symptoms. Otherwise, if they've got, we know that they've got the affect is affected already, is involved, which is the mood component. But now what is important is to make sure that they don't have the psychotic part, the schizo part. Otherwise, if they've got both of these, then it's not MDD, it's schizoaffective, right? So they must not be having delusional disorders. They must not be having schizophrenia from. So just think about this, the psychotic disorders here. And then there's criteria E. Criteria E states that this patient must not, sorry about that. So this patient must not have had an episode of a mania or a hypomania. Let's say this patient had an episode of mania or hypomania. It means that this is bipolar then. It's not MDD. Guys, I'm going to repeat this. It's very important. I'm going to try to be quick because we're done now. We're going to talk about specifiers on another video. So we have just done MDD. So we are saying that in order for us to diagnose MDD, we need, criteria A says that we should have 5 symptoms. And these symptoms must be there for 2 weeks. Very, very important. The duration, very important. They must be there for 2 weeks. And one of those 5 symptoms must either be a depressed mood or loss of interest. And we said that depressed mood, it can either be, a patient can report themselves to be feeling empty, to feel hopeless, or they feel sad, or it can be someone else observing them and saying, okay, she or he is tearful. They can use that description. And then the second one, a reduced interest or pleasure in things that the patient used to enjoy before. And these symptoms, guys, must be there for the most part of the day and almost every day. That's what it says. They must be there for the most part of the day and almost every day. And they must have weight. They must have weight changes, either a gain or a loss of weight that is unintentional. Very, very important. Sleep disturbances can be hypersomnia or insomnia. Psychomotor abnormalities, they can have agitation or retardation. Then they can feel worthless. They can have inappropriate guilt or excessive guilt. You know, when you've got excessive guilt, yes, you are to be blamed for whatever that happened, but sometimes the guilt is just too much. It doesn't correlate with what you have done. It's like maybe you broke. Let's say you broke a cup or a glass, someone's cup, but the guilt that you have, it's as if you have murdered someone. So that's an excessive guilt. And then they can, then now their cognition is involved. They start to be slow in their thinking, indecisive, poor concentration. And now this is where now they start to have reduced functionality, because if you've got loss of energy, if you cannot think properly, then you will have a reduction in your major functional areas in life. So fatigue, loss of energy, recurrent. So this part, guys, becomes very, very, very important, because from here you can decide if you're going to admit this patient or not. A patient who says that I've got suicide ideation or an idea to commit suicide, it's an admission, because they need to be under suicidal watch. Because if they go on and commit the suicide, and they came to you and you diagnose them with MDD, but miss the fact that they've got MDD with suicide ideation, then it can put you in trouble. So the recurrent suicide thoughts, it can be that they just have thoughts, there's no plan, or there is a concrete plan, or they've actually attempted suicide. That's criteria A. Criteria A is about the 9 symptoms. And then when you come to criteria B, so there must be a significant reduction in functionality, like I said, at work or at school, or in any of the major functional aspects of the patient. Criteria C says that these symptoms must not be better explained by a substance or any other medication. Substance D, there must not be any other psychiatric illness that can also better explain these symptoms, like schizoaffective, schizophrenia, schizophreniform, and other. And then criteria E says that this patient must not have, on top of these symptoms, they must not have had mania or hypomania, because If they had mania or hypomania, then it means this is not MDD, it's bipolar. So guys, that's MDD. We're going to talk about the specifiers on another video. Thank you.